The information provided in this video is intended for your general knowledge and is not a substitute for professional medical advice or treatment by your diabetes care provider or diabetes education by a diabetes care and education specialist. Everyone experiences stress from time to time, including people with diabetes. If too many stressors are present at once or intense stress occurs, this can lead to problems with your health and affect your blood glucose targets. When you are under stress, your body releases special hormones that can make your blood glucose levels increase. Learning to cope with stress is vital to your diabetes management and overall health. Some physical symptoms of unrelieved stress can include headache, trouble sleeping, fatigue, high blood pressure, nervousness, excessive sweating, hair loss, and stomach ulcers. Emotional and mental symptoms of unrelieved stress can include anxiety, anger, irritability, frustration, overreaction to everyday problems, memory problems, trouble concentrating, and depression. Managing stress involves reducing the stressors in your life and reducing your stress response. Regular physical activity, eating a healthy diet, and consistent sleep habits can have a positive effect on blood glucose levels. Here are some healthy coping strategies to manage stress. Get moving. Engaging in regular physical activity helps lower the production of stress hormones. It also aids with better sleep. Watch your diet. Healthy eating and good nutrition can help your body to fight off the negative physical effects of stress. Get enough sleep. When you are sleep deprived, the stress response can be worse. Practice good sleep habits by turning off the TV and putting away your cell phone, dimming the lighting and creating a peaceful atmosphere in the bedroom, and going to bed at the same time every night. Avoid alcohol or caffeine late in the evening, and taking a relaxing shower or bath before bed may help you relax and fall asleep. Reach out to your support system. Talking to people about your stress and asking for help is one way to manage stressful events and stress levels. Take a break. Be sure to leave your stress behind for a few minutes and focus on something positive or even the rhythm of your breathing. Even a short break can help, such as taking a walk during your lunch break. Schedule some time during the week to do nothing. Create predictability. Stress from surprising or unexpected events can leave us feeling upset. No one can completely prevent the unexpected from happening, but when day-to-day life is structured as much as possible, it helps you feel more in control when the unexpected occurs. Use positive affirmations. Use positive self-talk. Developing a more positive way of thinking can help cope with stress. Find a statement or phrase that is meaningful to you and repeat it over and over. This is called an affirmation. Here are some examples of positive affirmations. I am capable of change. I forgive myself for not being perfect because I know I'm human. I choose happiness. I live in the moment while learning from the past and preparing for the future. I commit to learning new things. Using relaxation techniques can also help to reduce stress. Some easy examples of relaxation techniques are progressive muscle relaxation. This technique involves tightening, then relaxing different muscle groups in the body. During times of stress, think of specific muscle groups and try to relax them in order. For example, start with the neck muscles, then shoulders, arms, and hands until all of your muscles are relaxed. This practice will reduce muscle tension and lower your body's stress response. Deep breathing. Take several slow, deep breaths. Inhale slowly and exhale slowly for 1 minute while focusing the mind on the movement of your breath. Imagery. Mental imagery is using the power of your imagination to reduce stress and improve relaxation. Imagining a peaceful nature scene or a favorite place can help reduce feelings of stress. Focusing on positive outcomes can also reduce stress and increase feelings of strength, control, and calm. Meditation. Meditation includes many practices that are intended to quiet the mind. During meditation, the attention is focused on a single thing while tuning everything else out. The focus can be on the rhythm of breathing, a mental image, or a sound. This intense concentration can bring about physical and mental calmness. Find a place away from distractions. Rest comfortably in a seated position. and allow 20 to 30 minutes for meditation. If 20 to 30 minutes is too long, start with just 4 or 5 minutes and build up from there. Yoga. Yoga is a series of physical postures that are practiced along with breathing techniques. As muscles are slowly stretched and breathing is controlled, a sense of physical and mental calm can result. Before beginning yoga, discuss the activity program with your medical provider to make sure it is right for you. Yoga should only be learned from a trained instructor. Tai Chi. Tai Chi is a traditional Chinese martial art that combines deep breathing and relaxation with gentle movements. Before beginning the practice of Tai Chi, discuss the activity program with your medical provider to make sure it is right for you. Tai Chi should only be learned from a trained instructor. Spirituality. Spirituality is a search for meaning and appreciation of life, which may involve organized religion, faith, and belief in a higher power. For many, a prayer is a powerful tool in managing stress and coping with life's problems, including diabetes. Remember, stress can affect mental and physical health, including diabetes management. Coping with stress can be enjoyable and fun. Some helpful ways to manage stress include talking to someone you trust, spending time with people you enjoy, participating in a hobby or new activity you enjoy, praying or meditating. Remember to ask for help when it is needed. Complete one task at a time. Try new things to relax. Set limits with other people. Get plenty of rest. And be positive. Remind yourself how much you have accomplished and everything you have done to help yourself. Research has shown there is a higher risk of depression in people with diabetes. Common symptoms of depression include feelings of guilt, lack of interest in usual activities, persistent feelings of sadness or anger, noticeable changes in your eating, alcohol use, or sleeping habits. Depression can also lead to a cycle of poor self-care habits, such as not exercising, not eating healthily, smoking, or increased alcohol use. If you are depressed and have no energy, regular blood sugar testing may seem overwhelming and too much to handle. If you feel you may be suffering from depression, talk to your healthcare provider as there are many treatment options available. Diabetes education is considered such an important part of your diabetes care that medical treatment without it is considered inadequate. To learn more about diabetes education and healthy behaviors such as healthy coping, contact Barnstable Brown Diabetes Education Services at 859-323-7391 or Diabetes Education Services at uky.edu.